Hi, Limbook Premed. This is Daniel Ju,
And this is Tiger Who.
and we're bringing you a presentation about cardiology that we didn't have time to present during the club meeting.
Cardiology is a branch of medicine that deals with the human heart. As you may know, cardio means heart and logi means the study of. As you can see, the heart is an intricate organ that requires delicate care to function correctly.
Let's talk a little bit about basic cardiac anatomy. So, blue arrows in this diagram represent deoxygenated blood, and red arrows represent oxygenated blood. Here we have the superior vena cava, also abbreviated SVC, and this is the inferior vena cava, IVC. These two large veins join together and enter the right atrium, which is the first chamber of the heart. From the right atrium, the deoxygenated blood flows through the tricuspid valve and into the right ventricle. The right ventricle then pumps your blood through the pulmonary valve and through the pulmonary arteries into the lungs. At the lungs, your deoxygenated blood receives oxygen and is sent back through the pulmonary veins into the left atrium. From the left atrium, your blood flows through the mitral or bicuspid valve into the left ventricle. The left ventricle is the largest and strongest chamber of your heart. The right ventricle is the second strongest. From the left ventricle, your oxygenated blood is sent through the aortic valve and into the rest of the body through the aorta. As you can see here, there are 3 blood vessels that haven't been labeled. These are all arteries that extend upward from the aorta and into the brain and supply oxygen. The first one is the brachiocephalic artery. This splits into 2 head vessels. They are the right common carotid and the right subclavian. This here is the left common carotid, and this is the left subclavian. As you may already know, all the valves in the heart have the same function. They prevent reverse blood flow through the heart. However, there's a key structural difference between the tricuspid valve and the mitral valve. The tricuspid valve, as the name implies, has 3 leaflets, whereas the mitral or bicuspid valve has 2. The geometric structure of the tricuspid valve allows it to close in on itself when the blood flow reverses and shut on its own. However, because the mitral valve only has 2 leaflets, its structural integrity is not as strong, and reverse blood flow would actually cause it to open backward if it wasn't for a set of structures known as chordae tendineae. These are basically a set of strings that prevent the mitral valve from opening backwards. So what's interesting is when people say tugging on your heartstrings, there's actually a literal or physical interpretation of that. The heart, as a muscle, also requires oxygen to function. However, just the simple action of pumping blood through its chambers is not enough to supply the heart with enough oxygen. That's why there are a set of blood vessels known as the coronary vessels. When the heart pumps and contracts, it sends blood through the aorta. This generates a pressure known as systolic pressure, and when the heart relaxes and uncontracts, the reverse pressure is known as diastolic pressure. When the left ventricle contracts, it generates this systolic pressure and sends blood through the aorta and into the rest of the body. When it relaxes, it's actually the diastolic pressure that sends blood through these coronary arteries and into the heart. This is unique because the coronary arteries are the only arteries in the body that function based off of diastolic pressure. There are 3 major coronary arteries that you should know. The left coronary artery splits into the circumflex artery and the left anterior descending artery, also known as LAD. The A here, anterior, means that it's in the front of the heart. So this picture is actually slightly rotated, and this side of the heart is the front, and this is more toward the back. The right coronary artery here goes to the back of the heart and perfuses the rest of the heart. From there, the blood is sent through the coronary veins and into the coronary sinus that's located somewhere around here. And this lets the blood go back into the right side of the heart to get reoxygenated.
Now that we looked at the anatomy of the heart, let's also look at some of the common diseases. Congestive heart failure is the impairment of the heart's ability to pump blood. It's really common and also can be really deadly. It can be caused through genetic defects or through an unhealthy lifestyle. These factors lead to high blood pressure, heart attacks, or cardiomyopathy, the buildup and enlargement of tissue in the heart. Congestive heart failure leads to a weak physique, fluid buildup in the kidneys, and general congestion because the fluid buildup in the kidneys leads to fluid buildup in the rest of the body. Some ways to combat congestive heart failure include to lower blood pressure, to make sure the heart is stronger at its job, and if it comes to it, a ventricular assistance device, which can assist the heart in its beating function. Another common and potentially deadly disease is known as coronary artery disease, which is damage to the coronary artery, the artery that perfuses the heart itself. Coronary artery disease is caused by a plaque buildup or inflammation of the artery. Plaque is a result of excessive consumption of cholesterol-filled foods. And because the plaque is blocking the flow of the blood through the artery, the heart will not receive enough oxygen, and as a result, will face immediate side effects. As such, there will be some horrible side effects as a result. Effects include angina, which is also known as chest pains, fatigue due to the lowered function of the heart, and an eventual heart attack. A heart attack in medical terms is known as a myocardial infarction. Myo means muscle, cardio means heart, and infarction is the death of tissue due to the lack of oxygen. Doctors commonly prescribe cholesterol-treating drugs to eliminate plaque from the artery. They may also insert a catheter to provide a balloon to widen the vessel itself, known as an angioplasty. Also, they might do a CABG, a CABG, a coronary artery bypass graft surgery, which utilizes another vessel to bypass the cholesterol or plaque-filled part of the artery and thus have blood flow swiftly through the artery.
Cardiomyopathy is the hypertrophy or enlarging of heart muscle tissue. The thickening of the heart muscle impedes blood flow due to the enlarged walls. This causes a smaller interior hollow chamber of the heart, which obviously means reduced blood flow. Cardiomyopathy can be genetically induced or caused by cardiac malformations. The effect of cardiomyopathy is a weaker heart and distorted valves, which cause regurgitation in the heart, angina, which is chest pains, and arrhythmias, which is irregular beating of the heart. Cardiomyopathy can be treated with pacemakers, which regulate the activity of the heart and reduce the chance of arrhythmias. And if necessary, a transplanted heart may have to be used. A host of cardiac malformations may occur as a result of either genetic disorders or malnutrition during pregnancy. An atrial septal defect is an ostium or a hole between the atria of the heart. A ventricular septal defect is an ostium between the ventricles. Both of these defects cause a left to right shunt, which means that blood flows from the left side of your heart to the right side of your heart. This is generally not too large an issue because the rest of your body is still receiving oxygenated blood and it's only slightly less efficient. However, as this irregular flow of blood continues, another problem may arise. Because of the increased pressure in the right side of the heart, due to the excessive blood coming in from the left, the right side of the heart now has to pump even more blood. This results in hypertrophy of just the right side of the heart, and eventually the heart becomes like a boot-shaped organ. Eventually, the right side of the heart will overpower the left side of the heart, which results in a right to left shunt. This is actually a serious problem because the right side of the heart carries deoxygenated blood, and now you're pumping deoxygenated blood to the left side and then through the rest of your body. This is known as a tetralogy of Fallot, and here is a diagram on the right side. As you can see, the right side of the heart is drastically enlarged on the image below over here. And the blue and red blood here mix together and are sent through the aorta. In babies, this can result in a blue baby syndrome, which is cyanosis of almost the entire body in a baby, which causes them to appear slightly blue. A patent ductus arteriosus, or PDA, is an abnormal passage between the aorta and the pulmonary artery. Here on the left, you can see that there is an unnatural vessel connecting these two blood vessels. In children who are not yet born, their lungs are obviously not working because they are still inside their mother's womb. That is why there is this passage here in unborn babies that allows more efficient blood flow throughout the body. The blood that the babies receive is already oxygenated, and it is then sent directly from here into the aorta and through the rest of the body. However, when a child is born, their lungs will begin to function, and this causes this vessel connecting these two blood vessels to close off into a ligament-like structure. However, in a patient with patent ductus arteriosus, where patent means open, this vessel does not close off. This results in blood which is already oxygenated being sent from the aorta into the pulmonary artery. The reverse direction generally does not occur because the aortic pressure is much greater than the pressure in the pulmonary artery, as the left ventricle is much stronger. However, this poses a problem because we now have increased blood flow into the lungs, which can cause hypertension and then lung damage. And it is also just a little less efficient for blood to flow through the aorta into the rest of the body.
In order for cardiologists to effectively diagnose or study various diseases of the heart, they use many tools. One is an EKG machine or an electrocardiogram. This machine measures the electric impulses delivered to the heart and displays them as graphs. Cardiologists also use many imaging devices to diagnose problems. One is a echocardiogram, which utilizes ultrasound-like techniques to develop images. Another one is a MRI, which is a magnetic resonance imaging. These utilize electromagnetic waves to develop images. And finally, there are CT scans, which are also known as computed tomography, and these also develop images. What's special about a CT scan is that it produces really high quality images. However, unlike MRIs or echocardiograms, these images have to be still, and as such, they have to be used differently. In addition, CT scans use a much higher form of radiation than the other two forms of imaging, and as such, can be potentially harmful to the patient. Cardiothoracic surgeons also use various tools to help them in their surgical procedures. For non-invasive surgery, which are surgeries that don't involve large incisions in the body, surgeons use catheters, which are essentially long tubes that can be inserted in holes in the body. These catheters can carry balloons or wire stents that are used to enlarge various vessels.
In this scenario that the damage is too great to be repaired by an endovascular catheter, open heart surgery is necessary. When a patient goes through open heart surgery, the heart obviously has to be stopped because you can't perform surgery on a heart that is beating around. This is where the heart-lung machine comes in. The heart-lung machine replaces the function of both the heart and the two lungs. When cardiothoracic surgeons use heart-lung machines, they hook up the vena cava and the aorta to the heart-lung machine, effectively bypassing the heart. They then stop the heart using potassium and can begin operating. The heart-lung machine is not a perfect machine, and surgeons work to minimize the amount of time that patients are put on bypass because complications may occur and clots may form in the machine, which will then be sent throughout the body, and that would be a problem. Open heart surgery is a last resort because, as you can see in this image here, the chest is cut open and the sternum is split in half, and the patient has to be put under fully. This results in a pretty large scar right down the middle of a patient's chest. Cardiology is an ongoing study that is constantly being developed. It comes hand in hand with cardiothoracic surgery, and new techniques are being developed all the time. For example, on the top right image here, we have an example of endovascular repair of an atrial septal defect, as I mentioned earlier. This catheter is sent through a tiny incision somewhere on the body, and a catheter is inserted through the vessel and into the heart, where it opens up this parachute-like mechanism on both sides of the heart, which then comes together and seals the hole shut. Minimally invasive robotic surgery is also a relatively recent advancement. Here, the cardiothoracic surgeon can look into a monitor and see everything that is going on using a camera that is inserted into the patient's body. These robotic arms, as you can see in the monitor, are actually very small. They only require tiny incisions on the patient's body and are inserted without cracking open the sternum and causing humongous scars, like is typically the case in open heart surgery. This results in a lower recovery period and has a lower rate of surgical complications. Stem cells are also used by recent cardiologists to study the behavior of various diseases regarding the heart. This technique is on the bottom right image is known as the body on a chip. These spherical gray structures here contain cardiomyocytes, and they, under the right conditions, they actually beat just like a heart. Since these resemble the function of a heart, scientists can induce various diseases or various factors to estimate what the impact of these factors are on the heart in a patient. 3D printed models are utilized in very specific cases where the doctor is unsure of how to approach a situation. By creating a 3D model, the doctor is able to map out and plan exactly how he is going to treat a particular defect. Pursuing a job in cardiology is extensive and often difficult. Assuming everything goes properly and standardly, you spend 4 years in undergrad, you get your bachelor's degree, you take your MCAT, and then you get into medical school. There you spend another 4 years, and in the meantime, you can work in research labs and work as an intern. And after medical school, you then have to complete many years of residency. If you're lucky, maybe 2 or 3 years will do the trick, but oftentimes it takes up to 8 years of residency, especially if you specialize in a field such as cardiology. There are various programs that allow a student to shorten this process. For instance, UCSD and Washington University in St. Louis both offer a program that allows a student to combine their undergrad and med school at the same time, which results in roughly 6 to 7 years spent rather than in 8 years. If you make it through all these years of training, the pay is excellent. A survey was conducted in 2011 that included both cardiologists and cardiothoracic surgeons who had just entered the field and had been working for 6 years already. The median annual starting salary for the cardiologists was $272,000, and for those who had been working for 6 years, it was $402,000. For cardiothoracic surgeons, the median annual starting salary was $360,000, and for those working 6 years, it was $522,875. However, cardiology is not the best field for someone who is only interested in the income. Those who become cardiologists invest an extraordinary amount of dedication and passion in order to achieve their position. Thank you for listening to our presentation about cardiology, and sorry if the video is rather long.